You're listening to another episode of All the Bees with me, Dr. G, and my scrub tech, Bri. Okay, so we're back today, and we're going to talk about vaginal rejuvenation, which whenever I say those words around my family, they like my sister's always like, gross. Like, she's kind of a little bit prudish, and so she doesn't like talking about anything like that. Although I think it's important because people don't talk about it enough. And generally speaking, when we treat women for either labiaplasty or vaginal rejuvenation, they're like, I wish I knew this was even an option, right? That's the
Right.
overwhelming response. But first, we got to do celebrity gossip, and there's been a lot.
So much going on.
Do we want to kick off with Kris Jenner's new face?
Kris Jenner, man, wherever her and Lindsay Lohan are going, you need
Dubai.
to not gatekeep. Send the link. She looks phenomenal.
Yeah.
She looks so good.
Part of it might be that she updated her hair a little bit, I think.
From the Karen look.
Yeah. But she looks good. I do feel like the Instagram photo is filtered a bit.
Okay, that's what I was trying to figure out. Do you think there's a filter on? There has to be a little filter, right?
Yeah, because I think also I've seen some pictures of Donatella Versace, who also looks super great. But when you see her unfiltered, you're like, okay, that's more for real, like normal looking.
I feel like that's everyone. People get like a really good side profile of people's skin, and you're like, oh.
Yeah.
But she looks so good.
She does look really good. So I don't know if she had some like massive, whatever she did, she had some massive laser resurfacing at the same time. Because if you scroll down a little bit to her like a year or two again, I mean, still looks good, but you see how she has like normal wrinkles around her eyes? Like she's also less, maybe she's moving her face less, Don't smile. Kind of that like.
Yeah, she's probably got lots of Botox in there still.
Mm-hmm. Yeah, she's not.
It does look filtered.
Yeah, kind of filtered. But I mean, people saw her on the streets of Paris, and maybe she just got things tightened up a little bit. Certainly, she didn't change her makeup look, because sometimes that's it. But
no, she looks like she got the whole works.
Yeah, which she's already had. Like she's had a facelift at least once. So yeah, they covered it on one of the episodes like 18 seasons ago. So
I mean, she's about to be seven. She's about to be 70. She does kind of look like she's 7, but I mean, she looks phenomenal.
Yeah, she has everything at her disposal. So
right. If I had that much money, I would also be looking like that too.
Yeah. And see, her hair already starts to look cuter. I don't love the jacket. It makes it look like Men in Black and that there's 2 people in there, but
I've never been a fan of that shoulder padded, huge, massive.
It's okay, but with the top, anyway, that's fashion.
If we cinched the waist, it would have been cute.
But her hair looks cuter there too. She got rid of the slick
I just
back.
can't believe she did the Karen look for so long.
For sure.
Snatched. Go off, Kris. She's got to keep up with that young boyfriend. How old is Corey? Isn't he much younger than her?
I think so. Yeah. Yeah, I think so. Anyway, okay, moving on. Speaking of faces, do we want to talk about Mar-A-Lago face? I saw something too about the Mar-A-Lago dress or the Mar-A-Lago clothing. Basically, it's if you look, all of anybody affiliated with Donald Trump's inner circle looks and is female. They all look like morphed Fox News hosts with a ton of makeup, or generally speaking, really bad Botox and hair extensions. The what used to be a decent dress look for the corporate sheath, like a la Suits, has now been co-opted by them, and a lot of lip filler. So I feel like that is, I would not call it a plastic surgery trend unless it's a trend to avoid.
Yeah. Not a fan. Everyone looks like they shopped at White House Black Market. Is that what it's called?
Ow, yes.
Do you like that do you like that
No, I
store?
don't.
Okay.
I'm just saying, I
That's what the
mean,
dress is. They have so much money at their disposal, and that's what they come out looking. Everyone has that tiny little not tiny, but they
Col
all look the
they have
same.
the same blue sheath dress, which could be Black
Yes.
Halo, it could be White House Black Market, it could be I don't know. Anyway, the dresses are all identical, unfortunately. It
Yeah.
replaced the, like, skirt suit, and just the makeup is a lot. I just it's very dark, it's the lower lid eyeliner.
But yeah, no, they all look the same. And I'm a huge fan, don't get me wrong. Pretty much everything on me is fake. But I'm a hu they look like they were straight out of a terrible spray tanned, like
It's harsh. So, you know how we've been talking about the undetectable era? This is the opposite of that. This is almost like, "Hey, everybody, I want you to know that I get Botox, I get lip filler, I've got a fake tan." It's overdone, and I don't know. It's not subtle. I don't
they're all forming into one person, the female version of Donald Trump.
the laminated eyebrows, the tight dress, the heels. Yeah, they all are
Yeah.
starting to look interchangeable.
Yeah.
Boo. I give it a
Boo.
thumbs down.
I give it a 1 out of 10. So
Okay.
at least their hair looks decent.
So I know you've binged watched and you're way ahead of me on the Secret Lives of Mormon Wives season 2. Way ahead of me. I'm
Ugh,
like on episode 3. I
I have
have
so
to
much to say, and the
pay
fact that she's not watching it as fast as I need her to. We have 2 surgeries tomorrow that I have a lot to talk about in, so go
I
home
don't
and
think I
binge
can
watch.
catch up. Hi, I'm really sorry for your surgery. I'm going to be really tired for your surgery tomorrow, but I had to stay up all night and watch 6 more episodes.
Of Mormon Wives.
That's
Priorities.
right.
Can we talk about it just for a second because I
Well,
won't give any spoilers.
I think what's interesting is there's so much going on that show, and they just sort of blow past Taylor's mom's facelift like it's
Oh,
nothing.
yeah, she looks so good,
She looks great. Great.
yeah.
I want to
She
know.
looks like a whole new person.
She really so I feel like Taylor Frankie Paul supports mom's extensive plastic surgery. If she feels great, great. First of all, none of those girls should be dissing plastic surgery since they all had it. Um,
Yeah,
but yeah, her mom she lost weight and she looks so Ozempic face, right?
we love a little
Probably
Ozempic.
she just looks amazing. She looks really good. And that photo of her that were popping up from people doesn't even do her justice because I'm sure when she lost the weight, she had some skin sagging, but just her on the show, which is a testament to how good she looks good, which is,
Right.
maybe there's a filter, but they're actually moving around. And so you can see them looking a lot better. Like you can see them in their
Yeah,
natural habitat. She's in the kitchen making something, and you're like, damn, her face looks
right.
snatched.
Even on the show, and she showed up a couple times, it's like she looked really good. She actually came on the show, like, post, like, surgery, like, a couple weeks or something,
Yeah.
because she
And
was still talking about how her face was swollen and
right.
puffy, and
And you're like,
but she looks
it was
so
good.
good. I mean, if you're gonna come on the show and play the villain, you have to at least look good
Is she the villain on
because
the show? She's not, I mean,
she was so like I get it. Like Taylor's been through a lot, but as a parent, the way like Taylor's parents talk to her is just I could never talk to my children that way. Like I do not like them.
okay. I've only
Yeah.
seen her on like the episode and I was too busy looking at her face. I do feel like they were little like you just need to suck it up and stick with this guy because he has your kid
Her
and
dad was like calling her, he's like coming out. I know they're Mormon, but like yelling at her, calling her a whore.
right,
And she's basically like, if you don't get back with Dakota, like you need like that's none of their business. Okay.
right.
None
They're
of their
very
business.
judgy. You should just I think
So judgy.
the a parent's job is unconditional love unless they're,
Right.
a serial killer.
And if your daughter's sitting there crying, saying how unhappy and hurt she is, and then just saying she deserves this because she's opened her legs, like
It's shitty.
so crappy. Everyone I liked on season 1, I just need you to watch this whole season so we could talk about this a little bit more. But on season 2, you like all the people you hated on season 1.
Right. No, I'm starting to appreciate that.
And I'm so like, I loved Demi until Demi came off like this crazy fame, hungry, like terrible friend on season 2. And then I'm like, oh, ew.
Yeah, I know.
Yeah.
I was thinking this morning, like, should we revisit well, I'll have to finish watching the show, but maybe we're them
Yeah.
again for Halloween. I don't know. May to
We
October is
should
a
be.
lot.
We should be like the season 2 version.
Yeah,
We were mom talkers for Halloween last year, so now we need to do the updated version.
right?
Like even Zach, I hated Zach on season 1, and they came on season 2 looking like a little angel.
I know. That's some good producing there, I will
It
tell you.
is. Stay tuned. And then last thing I'll say, final episode, they dropped this like massive bombshell and then just end it. I had to
No.
stay up all night, looking. Can I say it?
No, I haven't even
Okay,
okay.
I'll wait.
I
All right.
hate you. Okay.
We'll go to the next one. Otherwise, I'll keep talking about mom talk.
Okay, what other stories Doja Cat, speaking of another, she's a favorite of mine. We saw this,
We love
somebody
Doja.
see, so I will just say, why wear this dress? If
We had like 3 people send this to us and say you need to talk about this on your podcast within like 2 hours. And then she's like, "Don't come at me."
don't
And
clock.
I love her self-confidence
I
because I
know.
don't know if I could do that.
I would not. Because she
I would
was
have
just
gotten that
at the Met
fixed.
Gala and she covered it up. So you
Yeah.
could potentially wear a dress that did not show off the egregious capsular contracture of her left breast, which sucks. That implant needs to come out. So,
Yeah.
and then if you try to go back through her timeline, I know she's had a mastopexy before, a breast lift, because she has visible incisions when she wears like a white t-shirt that's wet. But I
Oh,
think she
yeah.
had like a lift, then maybe a breast reduction, she said, and then
Oh,
implants. Like, it's unclear. I think part of it is also when people are talking about their surgery, they don't actually know what they did. So
right.
it gets all mishmashed. Like, she's not admitting to plastic surgery, but I swear the last breast surgery she claimed to have was a reduction, which,
That's
you know, what reduction did you have where they threw in implants?
yeah.
I don't know.
I feel like that defeats the purpose of a reduction.
I feel like Motiva is probably reaching out to her right now.
We'll give you some free implants.
If you can just get that out and then prove that we reverse Capcom. Unfortunately,
Mhm.
she's got a legitimately terrible problem. So the
Yeah.
implant is contracted and it's super high riding. So the treatment for that is a little complicated. You need to either get all that capsule out and start over, or create a new pocket and like close that capsule off. But either way, that space has been created and it's stretched. That upper pole has been stretched out. All that's going to take time to heal, and it's usually very unsatisfying after the first surgery. Like, you can make it a lot better for sure, but your risk for getting that same problem again is high, and it's never going to be quite right. But also, I do remember that she used to vape, so I hope she's not vaping now, because we know nicotine can potentially cause a risk of capcon. So hopefully that's not the issue. Some of it depends on what
Mm.
caused the capsular contracture. But just maybe wear a different dress, yo. I
Yeah,
don't know.
that's crazy.
Because she looked,
Can't wear that and then say don't comment.
and I do love her.
Or just get it fixed. I love her too. But if you had
But she wore, like I said, a different dress to the Met Gala, no pants, and that looked great. And you couldn't tell that she had Capcom like a week ago.
Yeah.
So just do that. Even though, like, she knows that's what everyone's going to talk about it. So she just said,
Yeah.
girls, I know.
I know. She wrote it out before she went on the red carpet.
Scheduled tweet.
Yeah. Set for 9 a.m. the next morning.
Lord. Okay. All right. And then I feel like, because this podcast mirrors a little bit of our conversations in the OR. We cannot not talk about
About the Diddler.
P. Diddy's trial. But it really has nothing to do with plastic surgery, and it has all to do with just awfulness. But I think probably the most interesting thing is that we mentioned it to our anesthesiologist yesterday about the trial, and he's like, "How are you hearing any of this? What are you talking about?" I'm like, "Do you not get the same news feed we get?"
You don't
Like,
want our
you
news
can
feed.
get daily updates on what's happening. People are reporting from the trial, like live
Yeah,
updates. And yes, Daily Mail is updating us, but so is the New York Times, so is the Washington Post. Like, give me a break, man.
everyone.
I I bounce between like Page 6 and Daily Mail and then the New York Times, and all of it is terrible. Terrible.
Yeah.
Ugh.
Every time I open my phone, I mean, and there are attorneys on there that are going and giving you like a
Right.
breakdown of what's going on,
Right.
like every other post.
Right. So you can
So,
get the legal perspective, you can get the just horrifying, this is what happens when somebody with a lot of power and a lot of money exploits young women, like the true patriarchy, misogynistic nature of our culture, like, is awful. So I mean,
yeah.
it's like next level awful what he put her through. And then I think, what did I teams you afterwards? Because
Most importantly, you can get our perspective. I wish we could add our team's messages on here. She was like, let me pull it up. Combs' defense says he might have been a bad boyfriend, but he is not guilty of the charges he faces in trial. All caps, a bad boyfriend.
might have
Mm,
been a bad boyfriend.
being
Really?
a bad boyfriend.
That's how you're gonna label this relationship? You're 20 years
Okay.
older, you have a bazillion dollars, you're controlling her career, you're hiring escorts to have sex with her, you're recording it, like,
Yeah.
you're feeding her with drugs. I mean, a bad boyfriend forgets to pick up your fucking dry cleaning, to be honest. Like, what?
Or eats good food without you. Maybe even like a little lying and a little cheating. That's a terrible boyfriend, okay? But this is not being a bad boyfriend. This is on a whole other
Are we
level of
and then no, what really bothers me about the legal system and lawyers is they're not even saying he was a bad boyfriend. He might have been. Might have been. Like, what are you talking about
bro.
might have been?
Mm.
Which
I think
time
some
when
of
he
her
when
assault pictures proves.
right. Like, okay, I'm unclear if that is a might.
Like, that's
He beat you.
so
Pretty sure
mind-boggling.
that is the definition of a bad boyfriend or a
Yes.
domestic abuser.
Yes.
Ugh,
He beat you, pimped you out to sex workers. Like, look at that. Okay.
just
You know
terrible.
what? We should start like being the people that comment on the trial and be like, this is our version of what's going
Oh,
on.
yeah, I wish we had gotten, like, press passes to go. Here, let
Oh, that'd be so good.
I can't.
I think we need little mics in the OR because all of our best conversations happen in the operating room.
I just think it's shocking, and then the our poor anesthesiologist who was like, "What?" And then I asked Dr. Chow as well. I was like, "Ugh, I got out of the OR and I was like, let me see what's happening in the trial today." And she's like, "Oh, what's happening? I'm not following that." I'm like,
Are these people what?
yeah.
Let me guess. She's also not watching Mom Talk.
I mean,
So
if she's not, we'll have an intervention on her behalf. I feel like it's a plastic surgery requirement.
I think so too. That is part of the interview process to get in here. Do you watch The Secret Life of Mormon Wives? Are you following the Diddy trial? And what
What's
else?
your opinion on Blake Lively? I had to break that down actually at a dinner when I was in Napa Valley for the California
Oh, geez.
Society. Yeah. So I went to a dinner that involved a Stanford microsurgeon and a former president of the Aesthetic Society. And then our host, a male sales rep, was like, "Wait, what about?" Oh, because one of our other host, who is a female rep, said she ran into Justin Baldoni at a conference, I think in
No
Maui.
way.
He was on the beach with his family. And she said he's gorgeous in person. He was lovely in person. He was so gracious to everybody, very friendly, approachable. And the men at the table were like, who?
Of course. It's like we didn't know who Travis Kelce was until he started dating
Kelsey.
Taylor's whatever. The guy that's dating Taylor Swift. I was like, "Did you?" He's like a like we all know who he is now. Like
That's right. We did say, well, I mean, is he even good at football? And our anesthesiologist's head almost exploded.
he almost dropped the curtains and was like, "Bitch."
When he has to stand up, it's like trouble.
He's
Um,
like, "I hate it here."
yeah, so then we had to break down the whole Justin Baldoni, um, Blake Lively situation for the men at the table, and I feel like they're like, we can never get that 15 minutes back. Whatever, you're welcome.
Yeah. Please listen to our podcast.
I know. Please like and subscribe if you want more. Okay. So let's talk about vaginal rejuvenation, and what we offer is a CO2 laser, which is generally the recommended treatment. There is an alternative. It's called radio frequency energy. It was kind of the original. It was Thermiva was the original vaginal rejuvenation tool, which was designed to stimulate collagen and elastin in the vaginal canal. And it just takes a little bit longer. And I feel like we know CO2 is your kind of gold standard for collagen production, right? So when we use it on the face or on a scar, so it makes sense that that would be superior to radio frequency energy in the vaginal canal, but there's still an option. But that's the one we have is the CO2 laser. That's the one that they're talking about in this article from, the esteemed journal, the Daily Mail. um
Esteemed.
peer-reviewed Daily Mail. The device, just like with the CO2 laser, which is lovely for your face, it's fractionated. It's poking little holes of energy into either your mucosa or your face, and then your body's going to go in and repair that. And so that helps, like on the face, smooth fine lines and wrinkles. In the vagina, it stimulates the mucosa to kind of tighten up, essentially. But it's very subtle. Usually needs to be done 3 times, but it has been shown to increase sexual function in menopausal women. And supposedly in this UK study, increase libido or the number of orgasms women experience. Again, not sure how they did the study, but Journal of Lasers and Medical Sciences are trying to show that it has a positive effect, which duh, we know that, but you have to prove it. And I feel like maybe almost 10 years ago now, the FDA came out and said, oh, you can't advertise this. So that's the problem. Like the laser's there. We know it has this application, but the FDA will prevent you from marketing it if you don't have studies to show that it has an effect. It's considered off label, and then any marketing is considered a little sketchy by the companies. We can market whatever we want, honestly, but you just have to give that caveat that it's off label. So I think this is the point in time where people are going to take some time to maybe study it a little bit more effectively and show that it has a positive effect in women. So, but
I
it
love
doesn't
that.
get talked about a lot, right?
No, I feel like it gives me the vibe. So this is not my wheelhouse. I know surgical stuff, so I'm going to go ahead and give you my interpretation of this laser. It just gives me like if you can exfoliate and like treat your face, why not treat down there? But it's like if it's getting all tight, wouldn't anything feel better up there? Right?
Right. Yeah, it helps with things that come with age and maybe weight changes and pregnancies, multiple pregnancies. So it helps with mild urinary incontinence, lubrication, and apparently, according to this study, sexual function. So I.
Slay. Then you don't have to get PRP injected in your clitoris.
Yeah, so that's an adjunct treatment that we don't offer because I feel like, I don't know. It just seems like, first of all, it seems painful, and I'm sure it's not, but it seems less proven. So it's
Yeah.
definitely an option, but it's not really proven. And I think no one's doing great studies to show that it is effective. So I just don't have people who are like willing to spend money on stuff that we can't like validate, right? We just
Right.
trialed a laser that will go unnamed, and neither myself or Dr. Chow got like revealing like before and after photo results. And I'm sure you can get results with that particular laser, but I need to be able to deliver to my patients. And so I don't need them to be squinting and saying, well, I don't really see anything after this first, $600 treatment. Well, you need a series.
Right.
It's hard. Like people want to see results. And so the PRP to the clitoris, which is considered what do they call it? The G shot seems like,
I just learned about it from a patient the other day,
yeah, it
so
seems like, yeah, maybe it would work, maybe not. I'm happy to do it if you want it. Like we
yeah.
can spin it down and inject it in there, but there's no way to prove one way or the other that it's doing anything for you. Literally.
Yeah.
So you can inject PRP into the scalp and maybe see hair growth, and that's like oh, I can see that. And with the vaginal laser, you do a treatment. My biggest issue with this treatment is because it's CO2 and because it's, not as high. You can do CO2 to your face in a series, like a low setting, and then do multiple treatments, or you can like blast it all at once and maybe not have to do anything for 2 years. But this, you can't crank it. So it's three treatments. But the hardest thing I've seen is after one treatment, people are like, oh my God, I'm way better. And then they don't come back for the
You
last two
don't come back.
treatments. And you really are going to maximize results if you stack the treatments, because the CO2 is going to stimulate your body to increase collagen, and that is going to build over the next 3 to 6 months. So doing 3 treatments a month to 6 weeks apart is really going to get you the most bang for your buck. But
Yeah.
people definitely feel a result after that first treatment, which sells itself, right? I'm not going to
Right.
offer something where people are like, meh, I don't know. I didn't feel anything. Nothing's
Yeah.
changed.
No,
So
I feel like everything I've heard from that, it's been all positive feedback. But
literally,
yeah,
we
it's like
haven't had a single patient that was like, this didn't work.
right. In fact, most people actually end up finishing the 3 treatments because they
Yes.
like it so much. It's like taking antibiotics. Like, you start to feel better and you stop taking it. I
Right.
don't think I've ever even finished a course of antibiotics in my life.
Oh,
I got
God.
30 pill bottles with 4 capsules of antibiotics left in it for 10 years ago. Just do it, finish it. The most
Oh,
important part is not the end of the antibiotics.
yes. Yeah. I can't. The like latent infectious disease doctor inside me just cringed, but it's fine.
You're welcome.
Here to help.
Um, so what is the most I know you kind of talked about this already. What is the most ideal patient, or is there anyone that's not eligible to get the CO2 laser?
I mean, anybody can try it because it depends on how old you were when you started having kids. So if you could be on the younger side of things and be interested in doing it, so 30s, I guess, if you had kids in your 20s. If you're a 35-year-old woman who hasn't had kids and doesn't like, you probably don't have any issues. As you start nearing 45, or you've had multiple children, 55, then those are mostly our demographic in terms of patients that benefit from it. And it's somebody who's, struggling with a little bit of minimal urinary incontinence, which means like you sneeze, you might pee yourself a little, you do jumping jacks. I don't know what other things make people pee. Laugh too hard.
I'm not there yet. I had C-sections and I'm only 30.
Oh
I
God,
haven't not
30.
started the pee myself process.
So yeah, so again, C-sections, but for the win, even though at the time it doesn't seem like a win. So those are patients who would benefit from it. Somebody who has maybe a little bit of vaginal dryness, because kind of stimulating that collagen elastin helps the function of that tissue, which increases lubrication. So that's another win. And then feeling like it does tighten. It's just like with the CO2 to the face, though, we're not doing a surgical repair down there. We're not putting the stupid daddy stitch that everybody seems to claim to have gotten and not asked for. It's a little bit of tightening. It's enough, but it's not like dramatic. So when you do CO2 to the face, you're not getting facelift results. You're not, lifting up
Yeah.
the skin, excising it, repositioning stuff. When you resurface the skin with CO2 laser, you get some fine lines and wrinkles disappear and you get subtle tightening. And that is the effective tightening you get with the CO2 laser. So those the ideal patient who has a little laxity, a little urinary incontinence, maybe a little dryness, those are all made better with the CO2 laser. Somebody who has, urinary incontinence that needs a bladder sling or, has prolapse, meaning their vagina is turning inside out, those are GYN surgical problems and those need to be corrected surgically, generally speaking. So we're not going to fix that problem. But for the milder symptoms, it's, somebody that doesn't need surgery, it's a great solution for solving that problem. And it's easy, right? It's super
Yeah.
easy. 3 days of vaginal rest and you won't even notice any.
Do
So
you
just
even oh, but not rest, just like
oh,
no
not
nothing
like
in the vagina for
labiaplasty. I
3
need to
days.
yeah, not
Okay.
labiaplasty. I need to lay flat. No, you're out the door. You just really shouldn't put anything in the vagina for 3 days. So no tampons, intercourse, et cetera, et cetera. That's all. I mean, it's
So the process, how does the procedure work? I could definitely give you my explanation because I know everyone loves how I explain things. But I don't think a little probe up the vagina is the way to explain it. So
It kind of is. So it's a probe. It has the laser guide is at the end of the probe. We put numbing cream on topically first because that you probably don't need to, but it just makes everybody feel more comfortable. And then you insert the probe and step on the pedal, and it'll like laser about a little circular area spot. And then you turn the dial on the probe, and then it lasers again like a clock. So if you're thinking about it as a cylinder, it's lasering all the way around, and then you pull the probe out by a centimeter and do it again until you're all the way at the end. And then you do it twice. We like to do 2 passes of that so that we're making sure we're covering the whole area. And then sometimes, well, not sometimes, but I also like to do a little CO2 to kind of that urethral opening. Can you CO2 the labia minora and majora? Sure. But again, the amount of tightening you get, skin tightening from that is not a ton. And so usually you're looking at a labiaplasty is your
yeah.
solution. So I wouldn't try it for that, but you can get a little bit of tightening with that. I just feel like externally it's definitely more painful and the bang for your buck is not as high. The whole thing
The
takes
viewer
15 minutes maybe.
lunchtime vagina tightening.
That's right. Designer vagina.
Slay. You're like BRB taking a lunch break. So
Yeah.
if you were doing a labiaplasty, would you suggest that patients get this procedure done with it?
You can,
Or
yeah, if that's an issue. You know that most of my labiaplasty patients trend young, right? I would say
yeah,
we should pull that data, but I would say definitely below 30 is.
very young.
But yeah, for the older patients, you can do your first treatment. Again, we recommend a series of 3. So you do the first treatment because we're putting numbing cream on there, do the treatment, and then do the labiaplasty. Then you combine your 3 days of vaginal rest, right, with recovering from labiaplasty. And then a month out, you're healed enough from the labiaplasty to do your second treatment. And then you come back one more time for the third treatment. So we definitely do it as a combined effort. The hard part is really advertising it, right? There's no before and after. There's
Right.
no doesn't come up in cocktail conversations.
You're like, hey,
Ask me about vaginal rejuvenation. There's no even like
right.
good like vaginal rejuvenation sounds hokey, honestly, but there's really no other way to describe it.
It gives me the vibe. I just learned on Instagram about something called Whole Talks,
Oh, right. We talked about this.
Botox.
That was
And that's what the vibe it gives me. No one actually really talks about it unless it's a very specific
that's a very
niche of
niche
of people that need it done.
Yeah, I feel like that's also not our community for the whole talks,
No, probably
but
popular
I
at Diddy's house, but just kidding.
stop.
Um,
Yeah, whole talks is a whole other topic that we don't offer here, just FYI, but it
no,
stems from a lot of times things stem from therapeutic indications, right? So when you guys were laughing about it in the office, I was like, well, yeah, they've been injecting Botox into the anal sphincter for a while. So you can get, the category of problems or diseases like anal fissures and hemorrhoids and all the stuff that goes down there that people hate. Like for an anal fissure, you can treat with Botox. Do I do that? No, because I'm
yeah.
not a general surgeon or a colorectal surgeon, but it's definitely in their armamentarium to treat that way. So I think someone's just been like,
And the what? Armin.
armament, it's like in my toolbox.
Okay.
Sorry.
We couldn't have said toolbox, Armin. I can't even say the word.
It's
So
definitely in your
ubiquitous.
wheelhouse. Toolbox, I don't know. Yeah, so it is a recognized treatment for that.
Yeah.
Don't get me to explain internal and external anal sphincters, and I've deleted all that. But for my general surgery training. So I could see somebody extending it to, relaxing I don't know why you would, but
I don't know.
whatever.
I feel like it
And
just
then
shows that
post
people
about it
are
on freaking Instagram.
I know, I didn't realize how popular it is, but it just, like, shows that people are trying to really take care of both ends of themselves, and it's becoming so much more
I
popular.
just don't think it's gonna last, to be honest. Although it
Mm,
is a small dose, I just think it's like people are always applying Botox to new things. And so
yeah.
there was scalp tox that I read about several years ago where they injected Botox into your scalp, which is
Was that for
probably
migraines?
no, migraines for Botox for migraines is effective. No, just layer it all in your scalp so that your head doesn't sweat, so that your blowout lasts longer.
Stop.
It was like a
Can you
Manhattan.
imagine how much
It's
Botox that
gotta be like
requires
50 or 100 units so that you don't sweat there.
to let your 3-day blowout last longer?
Mhm.
If that's
Girl,
insane.
dry shampoo.
It's like $1,200 of Botox if it's 100 units or
Yeah,
more.
it's crazy or more. But I'm
Just
just
go get
saying
like another blowout.
somebody threw it out there as a thing and it got covered in The Cut or some magazine and I was like, "What? Who's doing that?" That is like I have money to set on fire. But also it's just got to be painful and I just don't think, like no one's going to stick that out. It's not going to stick.
That's crazy.
But
That's
I don't know,
crazy.
maybe I'm wrong about the whole talks.
I didn't realize I sweated that much. I was like, I don't notice a difference in my hair. Just dry shampoo.
Yeah. I mean, when I work no, it's when, like, Soul Cycle was at the height of its popularity, so people, like,
Oh,
didn't wanna ruin their blowouts. I don't know.
but they wanted to still cycle and do Pilates, I'm guessing.
Correct.
So we can segue back to vaginal laser. Are there any side effects or like of doing it?
I mean, there's always side effects, but not in our hands, honestly. The settings are
Yeah.
reasonable. There's, like sure, you have to sign something that says there might be a complication. I've had, like, maybe one patient with a little spotting, but in general, there's no complications with it. However, could you go to some fly by night laser strip mall place and have them stick the wrong laser in there and burn your
Jeez.
vagina? I guess so, which was the FDA's concern when it first came out that it was going to get everywhere and then people were going to be, but we have Jason Emmer down the street in Beverly Hills doing just actual surgery even though he's a dermatologist in his office and getting his license, revoked and stayed. So you got to
Oh,
worry
I
about
missed that one.
like I will once again say make sure that your person is certified in what they're doing,
Right.
right?
Right.
You got to trust and you have to what we call credentialing the provider. So making sure that the person you're going to is legitimate and knows what they're doing. So
Yeah.
if it's important, don't go to some med spa, I guess,
Right.
would be my two
Yeah.
cents. Are results immediate? Yes, they're immediate, and then, they'll dissipate a little bit, and then they'll build back up, but you need to build on that treatment because we've got the dose titrated so that it takes 3 treatments, but we're not, making the first treatment so hard that it's not recoverable from, but you do need to build on it, if that makes sense.
Yeah. Is it a painful treatment?
No, and not at all. So you don't feel anything.
We love that.
Yes. So, let's talk about someone relatively famous who had it done, Jada Pinkett Smith. This is an old article, but from 2018, but she did vaginal rejuvenation. It's unclear whether she had a labiaplasty at the same time, but she definitely says that she had the laser treatment and that it took years off of her vagina. And here she says she's undergone 3 procedures. So she did the series of 3. And she says also on the outside, it looks beautiful, which makes me think she either treated externally with the laser, which you could do, which is a slow roll, or also had a labiaplasty at the same time. And she said it was mostly for her bladder issues. Like I said, having that helps with mild urinary incontinence. And despite her talking about it at the time, like I said, it's hard because it doesn't usually catch on. So, like, it doesn't trend as much as you would think it is. So,
No.
certainly didn't make the news like her alopecia did.
Or her husband slapping somebody.
Or her open marriage or whatever the hell is going on.
I feel like we don't talk about her enough. I feel like there's a lot of things we could say.
I don't know, but she must sleep in like a freezer or something because she does look freaking phenomenal. Like she does not age at all. Maybe her vagina was aging and she rectified that, but
it was the only thing aging.
The rest of her,
but she fixed it.
Yeah, the rest of her.
Now it looks like a 16-year-old. I'm not kidding. Quotes.
In quotes. My Yanni is like a 16-year-old. I'm not kidding.
You go, girlfriend.
Yeah, I mean, she's another one who like literally doesn't age, but props.
I know what I'm going to be doing on my lunch break. Don't come into exam room 3.
Get Azella on that.
I know.
Poor Azella, our RN. We need you to laser hair remove. We need you to laser our vagina. We need you to IPL our face.
I know. She's so lucky.
So lucky. Okay. I think that kind of wraps up vaginal rejuvenation. I mean, we've talked about it. There's not too much to know. It's pretty basic, straightforward treatment that delivers results. There's not a lot of things in plastic surgery that we can be as confident about, and it's a win.
Yeah. 10 out of 10 in my book.
Yes.
This one's a thumbs up.
Thumbs up. All right. I think if you're listening today and you want to know more about CO2 laser for vaginal rejuvenation, i.e. the Rejuvenate laser is the one we have, but definitely give us a call or DM us on Instagram.
Yes.
I think it's time to scrub in
and scrub out. Slay
queen. If you're listening today and have questions, need info about scheduling, financing, reviews, or photos, check out the show notes for links. Restore SD Plastic Surgery is located in La Jolla, California. To learn more about us, go to restoresdplasticsurgery.com or follow us on Instagram at restoresdplasticsurgery. If you enjoyed this episode, please share it and subscribe to All the Bees on YouTube, Apple Podcasts, Spotify, or wherever you like to listen to podcasts.